bargaining for insurance. It's September 13th. If CTA and ASOP in the district represented today, we're hoping to get a deal. So Diane's going to present what changes we've made.
Good.
We listened to what you all had to say last time. We think we got everything incorporated here. So we can go. The only change on page 1 is the 2020 is put in the first paragraph. If you go, no changes on page 2 that we're proposing. On page 3, if you notice that under 6A, I took out all the premium changes that we had been originally proposed. So you just notice there's no cross-outs anymore in the premium changes. On page 4, the first cross-out line, for some reason, we had talked about this the first meeting, that we were taking that out, and I don't know if it was crossed out or just disappeared from the last document, but I put it in there and crossed it out because it's current language, and we are proposing not to refund any more, not to fund any additional funds next year. And so I'm just showing that as a cross out and renaming paragraph. Well, I got that backwards. The next paragraph should be E. It's going to be the new E, and it's listed as F currently. I don't know how that happened, but
looks like you guys just struck. I think you got the F struck through.
Yeah, we do.
yes. Okay, so that's correct. All right, so that's the only change there. On page 5, all that I'm blacking out is really just cleaning up. It was stuff we had double lines in there for 2018 and 19, but we're taking out the old stuff so that it's clear. That there was no discussion about that, really. So that's nothing different, nothing new. Keep on going. No changes, no changes. You get to page 8. I did my best to try to write what we talked about, and to summarize, we talked about for those employees covered with an employee and a spouse or domestic partner. So if you have employee plus spouse coverage or employee plus family coverage, you are now going to be able to each earn half the rewards individually. So the employee can earn $300 a year and the spouse can earn $300 a year, and either one can do it or both can do it. So I added language in there. Beginning January 1, 2020, each eligible employee enrolled in medical coverage who actively participates in and completes the health reward required activities listed below between January 1 and August 31st will be eligible for an employee health rewards monthly credit in the amount listed in paragraph D below. So I added a new paragraph to state what the discount will be. With the first, so listed below, or listed in paragraph D below, beginning with the first premium in the following January and continuing through the calendar year, as long as the employee remains eligible through this time period. So really, I took out an amount in this paragraph. It's really all I'm doing. And saying, if you go to paragraph D, monthly credits for health rewards program completion depends on the tier of medical coverage in which the employee enrolls. For those employees on a 26 annual pay cycle, the credit is as follows. So employee only coverage, $50 a month. Employee plus children coverage, $50 per month. Employee plus spouse and employee plus family, $25 per month for employee and or $25 per month for spouse / dependent domestic partner. And then we say these monthly reward credits will be prorated for those on other pay cycles so that the annual amounts are the same. It just got the language only stated one time. I think it's clear, and what do you think?
Yeah, the question I have goes back to page 8 at the bottom. And at the end of that, the last sentence is underlined. It says, as long as the employee remains eligible throughout this time period. What does that mean?
Well, and that language is already in there above. It just means that you don't get the discount if you don't, like, maybe you're not in a health plan anymore, or you drop coverage for some reason, or you become a part-time employee and you're not getting health benefits anymore. It just means that you have to be eligible when you're applying for the, in the year that you're doing the reward, you have to have coverage with us, and the year you get the reward, because you might do everything you need to do, and then you don't have coverage next January. Well, you don't get the reward then, even though you're not active, you're retired. I just want to make it clear, and that's in the language already. I didn't add that. I mean, that's not something new. Because if you look at above it, if you look at the language above it, it's in there that way.
Okay.
You see, right?
So you couldn't like waive coverage and then still get the discount.
Right. You couldn't waive coverage next year and say, well, I did all my reward stuff, so I get an extra $50. No, you have to be covered to get it.
It's a
all that
discount
means.
for insurance, not a incentive program or a bonus for doing something.
Why not? All right, no, I get it.
Okay. And then the only thing, if you look at the bottom of page 9, we're saying we'll do on-site biometric screenings again for 2020. And we'll just have to talk about it after that, because we're hoping the clinic can handle some of that. And we'll have to see if it's still needed. On page 10, we just added a line about, right in the middle, that effective for the plan year, and this was in the prior proposal, effective for the plan year 2021, the covered spouse or domestic partner will earn the health rewards credit independently and separate from the employee.
This is in reference to the 300-300 split, right? This doesn't mean that in 2 years it becomes the 600-600 thing.
Correct.
Okay.
No, it's just in reference to that. And then on page 11, we added a paragraph where we talked about how, as bargaining units, you're going to try to help us increase our participation in the Wellness Health Rewards program. So the bargaining units agree that participation in the district's health rewards program is beneficial to the employee, as it brings awareness to each member's personal health situation, and awareness is a first step to understanding healthy and effective lifestyle habits. To help increase participation, each bargaining group agrees to work towards increasing participation through promotions and discussions at meetings, as well as in newsletters, emails, and other correspondence to their members. Each bargaining group will strive to increase participation by 10% beginning in 2020. I mean, it really gives you leeway. We're hoping that this is the intent everybody has, and that we're all going to try, and that you can get more creative. I didn't want to put a burden on you, but we're hoping that you get creative, and I don't stress the importance of it and how really, I just didn't want to put a lot in there, but we just really got to get them to understand that these programs are helping us greatly. When you compare us to other school districts, we're going to be able to say we have the lowest premiums and the best benefits in the state of Florida for school districts. And it's kind of amazing that we're still able to do that.
Keep it going. We're going to keep going.
Right, I agree. And, and I think part of it is because we've withstood the noise of some of our programs and have worked collaboratively together. And even if it's not always easy, we get there, don't we?
Without question. I do have a question, though.
Okay.
On page 11, in the change there with it's underlined in the third sentence, where it says, "and awareness is a first step." Would that be as a first step or something different? That just seemed to read awkward to me.
As it brings awareness to each employee's. Well, it's the health rewards program is a first
No,
step.
but if you read the beginning parts, it doesn't seem to For me, maybe it's just me.
I think it's just you.
It says the bargaining unit.
I'm
I see
open to
what
fixing
you're
it.
saying, and awareness is a first step to understanding healthy and effective lifestyle habits.
It's a bit of a run-on sentence, I will agree.
But read the beginning part, though. The is awareness part, it sounds good, but if you read the beginning, the is doesn't fit in there, is what I'm saying. Start at the beginning of the sentence, you'll see my point.
The bargaining unit agreed that participation in the district's health rewards program is beneficial to the employee as it brings awareness.
Now, what he's talking about is the second one. So it's is beneficial to the employee as it brings awareness to each member's personal health situation, and awareness is a first step to understanding healthy and effective lifestyle habits.
Okay, so you're saying awareness is the first step?
Yes,
Yeah.
yes.
See,
Back on page 10, we do need to clean up the reasonable alternatives because we no longer have the DPP, and we need to add in missions and the coaching. So we need to still do some cleanup there.
Well, in some of those, we just try to add things to make it easier as the time goes on. I think we just mentioned it to you all. Are you okay with us adding this alternative? And that's how we've been doing it.
Or being generic, that we would say that we would always provide an alternative.
Where are you?
Under reasonable alternatives on page 10, we had it specifically listed out that we had telephonic coaching, the diabetes prevention program, and the real appeal program. We now have additional programs, and diabetes prevention has dropped off. So I think that's something we need to clean up on our end about,
Not necessarily, I mean, is it important that we list them out as far as
What the,
your view, or just the fact that we will always have alternatives, alternative actions that can be taken? What's your thought?
Doesn't hurt to list them, just if someone's reading a contract and they're not aware, like that'll tip them off to something they might not see.
So then we have to clean this up because.
and the only reason I would push back a little bit on it is as United Healthcare comes up with new and innovative things, like with the missions last time, they're not listed in the contract, but we're doing them. So if we have specifics, like if we have somebody now who comes in, well, I want the diabetes prevention program, we don't have it. So I'm concerned if we have it listed,
Gotcha.
the names of the programs, rather than saying we'll provide reasonable alternatives for those, who aren't able to get the 4 out of 5.
I think I'd like to just take out the diabetes prevention program because if it's not available, it's not. But
Well, what I'm saying is I'm thinking maybe and maybe this is something we should have talked about before we got in here, but for those who do not meet 4 out of 5 requirements above, reasonable alternatives will be available.
Do you,
Instead of listing them specifically, because then that way we're not limited to what we can provide employees, because right now, if we were just limited to this, the missions that we've been doing and that are really super easy to do and effective, then we wouldn't be able to do those. That's why I'm, rather than being,
And we do always, every year, we review the official health rewards rules, and we specifically have gone through with the carrier what options are available before we print those. So I'm thinking maybe this paragraph should just be more generic, that there will always be alternative actions that are available, and you can refer to the official rules.
so where would we look to find what those alternative programs are for people who don't meet the 4 out of 5?
I was gonna
On the
say,
wellness, on the hub,
well, we publish the official rules
we
every
publish the
year.
official rules on the hub.
if you got somebody here to make a website that just had like a list of like clickable links, maybe, like you could put a hyperlink in here that says, we'll provide various programs, and if I click this link in a digital one, it could take me to a web page that can easily be changed by the district, obviously, that says,
yeah, we could do that.
Diabetes
We
prevention.
have
Say
that, we
as
have that,
published in the official rules every year.
and then
How about
something to
that?
refer them
it would
to.
have the link, that makes
To the
sense.
website.
Yeah.
Yeah, links are
If I
a
wanna know
little
what program-
problematic sometimes.
They're really, well, we keep track of
I
those
don't-
because it's in our contract. So then we would have the link, as
You
long
do.
as they're an employee, they would be able to look at it. The issue would only be in that if it's an outside person who's looking to come work for us, the link may not work, because if it's just on the hub versus the internet site, because they're two separate entities now,
Gotcha.
they wouldn't be able to see
Why
it.
don't we say in our official rules as published on the district's employee website?
But
Annual.
we're gonna link it.
And we can link it if we can, but if we put the writing there, then they know where to find it, even if they,
Yeah, you could put the reference and then the clickable link.
Yeah, because they're going to want to know what can I do? What are those things that I can do?
Right.
Excuse me.
And
because
two-
this, really, the language in here is very strict, and we've been more lenient, and we're not against being more lenient, as long as it's effective, If the mission cease being effective, we don't want to do those.
And Vicky, to your point,
Way.
is there a way to request that they not make it part of the intranet and make it the
No,
internet? Because if
the
we,
way
like,
they've, I get it. I mean, the way they've set up the websites now, there's some things, and I think wellness is probably one that's only for our employees. It's not for anybody from the outside to see. So we wouldn't be able to switch that out.
okay.
It is where it is.
Because just when you said that, because we link, since the contract is 200 pages for us and everything,
Right.
like we hyperlink on our website to the district's PDF upload of
Right.
the document, so people,
They
whether
won't
they
be
were,
able to link from PDF.
they wouldn't be able to click through to it.
That's why we'll state where it is as well.
Okay.
So then they can go and find it.
Okay.
Yeah, if they're not logged into the portal, then they wouldn't have access to jump to that link.
Gotcha.
And the last thing was on the on-site employee health clinic on page 11. I really just put in a new sentence from the last time. In the second to the last paragraph, that last sentence, I had to put in, we said that it was gonna be $10 per visit for employees, and we had this discussion, but if an employee is in the CDHP, they have to pay what is considered fair market. I can't let them only pay $10 because they have a high deductible health plan. And so in talking to our consultant the other day, they said, what's officially allowed currently is between $25 and $35. So we put in $25.
No problem.
And then I think I added pre-employment was in there and random drug testing. So I didn't have the word random. I just had pre-employment, but we want to use this clinic for random drug testing as well.
So you'll plan to, any potential hire, you'll funnel, because it says pre-employment, so you'll funnel through the clinic.
We figure that all those tests and the CDL cost us in the $400,000 range every year. So if we're it'll help us subsidize this clinic so that we're not saying that the clinic's costing too much. And we want the clinic to be used. So I want it to be officially for employee benefits. I want people to get the relationship and like the doctors and things like that. So that's how that's gonna be the main focus of it. But if this can help offset the cost of running the clinic.
It's a good way too. Every new employee would hopefully have a positive experience with the clinic from day
Right.
one.
Right.
I'd like to just suggest, since, our consultants are at this point saying $25, 25 to 35, can we make that a range, just so that we don't have to have an issue if that changes? Because we're talking about 2020 and 21.
What would establish,
One-year contract, though.
yeah, because what would establish who would establish the price point during a given year if it was a range?
It's,
We could establish what it was going to be, but for the purposes of contract language, because once it's here and we come back, if it's got to go up, then it would be that the CDHP has different kind of rules.
You put something like subject to,
Yeah, who sets that rate?
it's complicated. That's the complicated part. And I thought about that when I was writing it. but I didn't know what entity to refer to that sets it. So I don't know if it's the Department of
Health and Human Services?
It was, the EEOC got involved, believe it or not, in saying what constitutes a good wellness plan and all that. I think for now, if we leave it 20 and 21, 20 and 21, it's understood that we can't fully regulate that. And after that, if we decide that the clinic worked and we're going to continue with it, which it's going to cost a lot of money to set it up, we're very hopeful that this is a positive experience for everybody and that people like it enough to continue using it. That price is definitely probably going to have to be modified. I'm trying to set it at the lower end of it, but I don't want to later have people telling us that, oh no, you're going to get run afoul of the law.
So if that 25 to 35 price range that you cited, like that's established somewhere, you said some entity, is that published anywhere? Because, I mean, if we have to stay in that range,
Just
and
giving a
obviously the goal is to be at the
recommendation.
low end of that range, then maybe there's some language that says, based on this
Factor.
entity's
Let
assessment,
me find
whatever.
that out, and when I fix the language on the reasonable alternatives, I'll add as based on,
A cost share of $25 or as established by.
or the minimum as allowed by,
I'm gonna say the lowest end of the range, if there is an annual range set by some
yeah, and try
agency
to
or
cite
whatever.
And
it.
again, that has to be established, and we would be publishing that as part of the benefit schedule. So I'm just trying to, I think a lot of times, sometimes we get very specific and detailed in some areas that maybe we don't have to, because they're going to be guided by other documents that are going to hold us accountable.
If there's a published annual,
We'll have Diane,
Range.
Diane's gonna look that up and we'll figure that out. So are the changes that we proposed acceptable?
so I got a question or two. What is, last time we did healthcare and stuff, one of the topics we got into was the reserve fund. What's the current reserve balance for healthcare in the district? Do we know?
In the $60 million range.
And do we know what the statutory minimum is?
I'm required by the state of Florida to have
2 months or
2
something?
months, which for us at a high would be 36.
So we're required to have 36 and we have approximately 60?
Right. So
Okay.
we feel good with that right now.
And then the 5 million from the previous years, was the reserve fund the source of that, or was that from outside the reserve fund and operating budget, or
Operating budget,
it was?
yeah, we contributed
Okay.
more. And that's,
Okay. I wasn't sure, thinking back, whether that came out of the reserve fund or whether that was not from the reserve fund.
Well, it was from the operating fund into the reserve.
yeah, it's sitting in the reserve now.
Okay.
But it started with budgeting a little more for health insurance for all our employees in the operating budget.
Okay. For the clinic, do you have a building earmarked that says a building adjacent to this building? Do you have like
Where
a,
IBIS is out back, or where we do the computer training, and there's a few offices out there. There's
It's where
8.
they have the new welcome center for new students into the system. If you come in from Davis, it's those first little buildings there.
so it's just to the side of here?
Correct.
I
And
think
we're
it says a building E, it's those concretables that are lined
Okay.
up, 2 rows of them.
And would there be like a plan to put some sort of signage?
Oh,
Like, or-
absolutely. We're going to get first 2 concretables. It's going to be 1,800 square feet we have reserved for this.
Okay.
There's going to be a big sign that says the Diane Howard Health Clinic on it.
That's right. We worked hard for this. We already are planning to conduct a
You're gonna say when,
invitation to negotiate in the next couple weeks.
does the district have like an RFP primed up and everything?
Right, that's what we're working on right now, and what we're going to do is, they call it an ITN, and invitation to negotiate.
Gotcha.
We send it out, let everybody that's interested in running the clinic for us submit. We scale it down, and then we do the details with the ones that qualify, and then we'll review that. And our goal is to go to the board in probably January, February to get it approved, build it out, and then, I mean, I put July in here, it might be a little optimistic, but before the end of the calendar year of 2020, it should be up and running and hopefully successful.
Is there a way to establish that this body would be an advisory committee? So like there's 100 different options, hours of operation, days, facilities, what type of equipment. So is there a way that the district could establish a series of questions just to solicit our input? Because I know in the city when Boynton Beach opened up theirs, that was really one of the biggest questions, or the simplest questions to try to solicit information was, when should this be open? If everyone's at work from 9 to 5 every day in the city, we don't want to operate it during the day and not after work or not on a Saturday. So in the interest of just trying to make sure that there's some input from the unit side on potential, non-binding or anything, but just so that our input on some key questions on variables and tweaking and stuff like that.
Yeah, I'm certainly open to that. Even just in our discussions with the consultant that we're using for the clinics, we've even said we're going to put in there that the hours will be established and then could change. Because if we might say on Tuesdays, we're going to open at 7 to help people that want to come early. But on Fridays or Thursdays, we want to open late and start at 10 so that we can be open till 8 maybe.
Yeah, that's trying to fit around the employees. And obviously there's a ton of different schedules between the different bargaining units and the district. But yeah, I'd want to make sure that, like you said, not only was that subject to some input based on needs or demand, but also renegotiable with them, whoever you contract with, on whether it was an annual or biannual basis. If you felt like, because you'll be able to monitor usage after a year and determine that maybe on, opening up from this time period, you only saw a tiny amount of people. And so just flexibility to adjust, like you said.
The thing that I would say we could do is under section 15, engage, make, rate, or rewards, and next steps, we have a list of things that we will agree to discuss throughout the year, and we can put clinic operations, just add it, and that way it gives this group the ability to meet throughout the year and talk about things related, because, we want this to work, and if we can make, if you hear from your members about things about the clinic that, they would like, and that we get enough of them, we should do it. That would be a viable thing to make the clinic successful. So I could do that.
Yeah, because that's basically the list we work with on this quarterly meeting to cover various topics. Yeah, I think it'd be good to keep it at the forefront as it becomes a new enterprise that we're doing.
All right, so I'm going to put clinic operations.
Yeah, that would cover everything.
On-site clinic operations.
Yeah, on-site clinic operations.
That would be part of the RFP anyway, though, or the other initials you gave out, or the ITN or whatever, when you're requesting input from them anyway, correct?
Yeah, well, I think the plan is to set it up, to figure out who's going to provide for it.
Sure.
And as Diane said, it's going to be a fluid process in the beginning of, maybe we set it up so that on, like regular doctors, like on Thursday nights, they're here, Thursday night's a late night, Friday's an early night, but they come in early or something like that, so they vary the hours. And let's say we do it that way and we find out, well, people aren't coming late on Thursdays, but they're complaining because they need to be here on Mondays late because people are sick on the weekends. That would be something that she's building into the contract so that we would be able, that would be a little more fluid. So that's why, you know, if you have these conversations with this group, as issues come up, then we can address it with the provider.
And the consultant we're using, his job is setting up employer clinics. And he's done it with a lot, you know, he has a lot of ideas, things that we didn't think about that are important to do at a clinic. And he's helping us with how it should be designed, how many exam rooms you should have, what services you should use in it, things like that. And a lot of people, you know, people start hearing you're thinking about doing something, they all have their input, and we're getting a lot of good information about it. So we've had some good planning meetings so far.
Could you put just a note when speaking with that consultant to inquire about app-based appointment, like software? Because I know that I've heard, I don't believe we have it in the city, but I know if the goal is to make it as easy and user-friendly as possible, if there's some simple app that, you know, can be written for $500 where as long as you type in your employee ID and you click an open slot. So
Okay.
just to
that's a good
inquire,
point.
because if he's done a bunch of these, I'm sure he's seen some version of that somewhere.
Good idea.
But I think that's all my questions.
Okay, I mean, I can get this written up by early next week and get it to everybody to sign off on.
And I apologize again for not being on time. Unfortunately, I had
We
to
know.
take a medical or
Right.
what were the big issues though that were changed on it, if you don't
Really,
mind?
what we did was we heard what you said about the domestic partner or spouse who does, one half does the rewards, the other one doesn't. We built that into the system, so now that if you are in the system but your spouse doesn't want to do the wellness rewards, you would
Okay.
get some portion, you know, half of the rewards. You'd be able to do that. That's,
Not all or nothing anymore. For
right. It would be all or nothing anymore.
You
Okay.
can get half, or if your spouse does it,
Yeah.
then you both
Okay.
get half.
That's really the big thing, and the fact that we agree to open a clinic.
In the clinic, okay.
Clinic
And
down
then I understand that what you were talking and oh, that's great. Anything else other than that was major on the clinic portion of it?
$10 copay.
Yeah.
Yeah.
Nothing new. Yeah, no, but
That's, I don't think
that
the
was in
question,
question.
so.
If that consultant gives you like a list, like, you know, if he solicits from you answers to a survey of questions to try to hone his scope of what he thinks he can do, just if you wouldn't mind sending that to us, just so I'm curious about this too, not just for our sake here, but just in general, just to educate myself more about them as we get into it. So I don't know if you get some sort of survey about, you know, what would your clinic look like, just to look at. I'd appreciate that.
I just have one quick question on the rewards thing too, and maybe I just missed it this year. I know last year when I did the rewards to get the cheaper rates, they came to my school, and I didn't know they were coming there either. It just so happened that they were there, and I was able to take advantage of it. Now this year I went to Quest, and I did all my stuff there, but I haven't heard back from them. Is that, or did they contact you, or what did they do?
If you did it online, you should have got an email back from them saying that it's been received.
I went to Quest, and they did the.
But did you go online and sign up online
So
through
yeah,
our?
and they gave me out where to go and stuff like that.
Yeah,
All right, I'll just check into it. I thought it was.
yeah. You should see it if you go into the MyUHC website. You should see that you met your. Did you do the survey and everything else?
I believe so, yes.
Okay. We can help you individually with that. Any questions? All right.
All right, so we're going to consider this, that you guys have signed off on it. We're good to go. We'll make these minor changes that we just discussed, and we'll get them over to you for signature. Thank you very much.
Sure. Thank you.
It's great to get something off our plates.
That's right.
When you What was it, instead of an RFP, what was it you referred to it as? Letter to negotiate, or?
ITN, intent to negotiate.
That'll be a public document once it's submitted out, obviously, right?
Oh, yeah.
Okay. Yeah, we're just curious about that too, if, whenever that goes out.
We're struggling with the questions that you put in an ITN, because I gave a list of questions, and then purchasing said it's too broad for the beginning part, and so as we get them, we'll share them.
Thank you, and have a nice weekend. Try and stay dry.
All right, guys.
Thank you.
Holding everybody up.
Stuff happens, we know it, especially in your world.
All right, thank you.
Thank you.